Hi, this is Annie, and here is my female hormone case presentation. This client is a 19-year-old female of Eastern European descent. Her chief complaint is facial acne for several years ever since she hit puberty. She's also having mood swings, outbursts, and severe morning fatigue. Aside from having occasional irregular periods, she doesn't really have any other health concerns. Her endocrinologist diagnosed her with congenital adrenal hyperplasia, which is an inherited disorder of the adrenal glands. This is basically when there is a SNP in a gene causing a deficiency in the enzyme that makes cortisol. So basically, this congenital adrenal hyperplasia is responsible for the decreased production of cortisol. Her bowel movements are regular. Her family history includes metabolic syndrome on her dad's side. Her mom has osteoporosis. She's postmenopausal. She has elevated iron levels that are unexplained. And her paternal grandmother has ALS. This client has a normal BMI. Her dietary recall: she doesn't really eat breakfast. She'll drink some milk, have a small piece of cheese with a little piece of bread. For lunch, she normally eats out. She usually gets a drink from Starbucks, some fast food, something small like fries, and she'll grab some sweets like a donut or a cake pop. And for dinner, she'll have yogurt, milk, cheese, some kind of protein, usually chicken, pasta, and some vegetables. She spends most of the day outside working. She eats out every day, but not in large amounts. When she gets home, she eats a lot, whatever her mom cooks. She drinks a lot of dairy, almost a gallon a day. She has a high intake of processed foods, refined carbohydrates, and sugar intake. She has inadequate water intake and inadequate consumption of quality lean proteins, essential fatty acids, and phytonutrients. She's very active. She lives at home with her parents. She's a college student studying pre-pharmacy, and she works as a pharmacy technician at CVS. She works really long hours. She's always on her feet. She also uses a lot of over-the-counter face creams to cover her acne. Her sleep schedule is not the greatest. She sleeps after midnight, and when she wakes up, she feels very groggy. She has a hard time getting up. She has a lot of stress. The acne affects her confidence, which impounds on her stress. And she's not on any medications, and she's not taking any supplements. She did do a hormone metabolite test, and this is similar to the Dutch test. As you can see here, she has HPA axis dysfunction. Her waking cortisol was very low, and her mid-morning cortisol was within limits. Her afternoon cortisol is elevated, and her evening cortisol is within limits, and her bedtime as well, but her waking cortisol again in the next morning was very low, which would explain why she feels so groggy waking up, and it's hard for her to get out of bed. She doesn't have any cortisol in the morning. This is probably one of the reasons why the doctor diagnosed her with that condition. However, because she is producing cortisol in the afternoon, I would question that diagnosis, especially because a genetic test was not done. And based on her dietary intake of the refined carbohydrates and the sugar while she's out in the daytime, that would also indicate why her cortisol is spiking so high. This is cortisol, the metabolite of cortisol. Her estrogen markers, right here, they're all low and below detectable limits. And her androgen markers, so her testosterone was low, and testosterone metabolites are low, but her androgen is high and her DHEA is elevated. So remember, her chief complaint was acne, and acne is considered an androgen dependent condition. The causes of that can be idiopathic, or the SNP, which is a defect in the 20-hydroxylase enzyme, or PCOS, which her endocrinologist actually ruled out. So the summary of evidence: she's diagnosed with congenital adrenal hyperplasia. She's been having facial acne since puberty, which are due to the high androgens that we saw. She has HPA dysfunction indicated by her wonky cortisol levels, and her mood swings and outbursts could very well be due to her low estrogen. And she doesn't have excessive hair growth, and PCOS was ruled out. Contributing factors could be very well from the diagnosis that the doctor gave, possibly a genetic condition. It could be exacerbated by the trigger foods and by her stress. The nutrition priority would be a low glycemic diet, avoiding all the trigger foods, and also to manage her stress and to avoid endocrine disruptors, which can exacerbate her issues. So for the intervention, I would recommend that she avoids milk, which contains hormones, estrogen, progesterone, androgens, and glucocorticoids. She should definitely avoid trans fat and the high fat foods because it decreases the sebaceous secretions and inflammation. Avoid all refined carbohydrates. I would suggest a low glycemic diet for her because a high glycemic diet can actually promote acne. And incorporate a variety of phytonutrients at every meal, adding in some soy and soybean isoflavones, phytoestrogens, flax seeds, which she can ground fresh. Make overnight oats, bring it with her, eat it in the morning, make a nice smoothie for herself, add some greens in there, take some nuts with her. If she likes yogurt, she can have a non-dairy yogurt, or she can carry it with her when she's out at work and school as a snack. She can also add adaptogens if she likes. Licorice tea in the morning to boost her cortisol, and an adaptogen coffee with ashwagandha like 4-sigmatic in the afternoon to kind of balance her out. Vitamin A, high dose vitamin A is known to reduce sebum production and treats acne. However, there are some cautions, so I would definitely work with her PCP with that. Omega-3s for inflammation and a probiotic for her gut integrity. Avoiding endocrine disruptors like all of the over-the-counter face creams and replacing them with nicotinamide gel, vitamin C, calendula, maybe a fruit acid peel. Avoiding plastic bottles, replacing them with food-grade stainless steel. She can carry that around with her at school and work. She can do red light therapy if she likes, and also to manage her stress, to socialize with her friends, have family outings, because she's always on the go and she's always strung out. Maybe certain things to slow her down, like reading, journaling, art, stretching, grounding. She lives in Florida, so that can easily be done. And for the recommended labs, I would suggest that she gets her vitamin D levels checked because of the risk of her bone health with her low estrogen. A full thyroid panel, just to make sure that there aren't any underlying thyroid diseases that are causing the low estrogen levels. Micronutrient panel, I would definitely have her screened for eating disorders because anorexia, bulimia, they can all contribute to low estrogen levels. I would evaluate if she had any extreme dieting history. And while she's eliminating her trigger foods, I would monitor her and while working with her intuitive eating practices, at the same time having her use a food mood journal. I'd also refer her back to the endocrinologist to strongly urge that she get the genetic testing for the congenital adrenal hyperplasia because there are some implications to the different types of that condition, and then that can guide us towards best practices. And also to check for any underlying thyroid or pituitary gland problems that could be responsible for why her hormones are all out of whack. Thank you.